All right, good evening, everyone. I'm going to reconvene the recess budget workshop of March 19th, 2025. And this evening, we're going to start off with the EMS dispatch group.
No, just dispatch first.
Sorry.
Those are two separate departments.
Dispatch.
You dispatch all three, so.
Excellent. And Mr. Timniak, they're on, what is it, page 50 of the budget book? Communication.
Yeah, page 50, yes.
All right. Excellent. Whenever you're ready, feel free to start.
Good evening, council members. Thank you, Chairman. I am Dispatch Superintendent J.P. Straczynski. With me is Dispatch Supervisor Heather Edmonds. As you know, we're here tonight to present the fiscal year 26 communications budget. We are requesting overall a 0.64% increase, which is less than $10,000 year to year. Our Stratford Dispatch team has been working efficiently to improve our public safety communications, and I wanted to bring to you a few highlights. In calendar year 24, we handled 105,800 total phone calls, including over 22,000 911 calls. We managed a state 911 outage in October of 2024, which you may remember. And as a result, working with Ed Kingston and his team at IT, developed a redundant backup plan that does not rely on the state in any way. We have expanded our radio communications capabilities with 2 additional consoles in our dispatch center. We have increased outreach and 911 education in the community overall, specifically with the school system, along with Public Safety Director Ciccarelli. And we've improved our 911 call taking answer times from below 90% within 10 seconds on average to over 95% within 10 seconds on average, which is a statewide level that they look for. Finally, to address staffing, we've experienced some turnover in the last 6 months. Some of our seasoned staff have departed for better opportunities, including a Norwalk dispatch supervisor, a Stamford dispatch supervisor, a Watertown dispatch supervisor, New Haven police officer, and an electronics assemblyman at Sikorsky Aircraft. Although we're disappointed that these full-timers have left our employ, each one of them has requested to stay on part-time, which speaks to the credibility and the quality of the center that we run. And when we advertised the full-time job description, we received an overwhelming 55 applications statewide, 55. We have made offers and accepted all 5 of them, and so although Heather and her dispatch training team is working on it, we have 4 people coming through training in the next few months. So I'm ready to answer any questions that you have about the budget or our operations.
Excellent. Thank you very much. So at this time, we are open for questions to the Dispatch Communications Department.
Through you, Mr. Chair.
Ms. Shea, go ahead.
Thank you. Good to see you all. Thank you for the updates. Thank you for having updated updates in our budget books. We all really appreciate that. Could you repeat what you said about the 911 response? You said it was 95?
So the call answer times?
Call answer
Yeah.
times.
So the state of Connecticut puts a fairly arbitrary standard on 911 dispatch centers, which is they need to answer 90% of their 911 calls within 10 seconds during the busiest hour of the day. That could be at 2 o'clock in the morning when there's a structure fire. It could be at 3 o'clock in the afternoon with a major motor vehicle accident. So there's really no way to plan for it other than to continue to express to our dispatchers how important it is, to post our times weekly and daily. And now we actually even have a dashboard in our console, in our dispatch center, so you can see how our call answer time is going. So a couple of years ago when they first started this, we were hovering around 88%, 89%. We got north of 90%, which the state was happy with. But within the last year, we are averaging around 95%, which means that during our busiest time, 95% of our 911 calls are answered within 10 seconds.
And that's great to hear. What were the changes made that led to, I guess, a better response time?
Sure. Education of the dispatchers, letting them know that this standard was important. Also, letting them know policy changes. For example, if we're on a call with a citizen complaining about, let's say, an abandoned motor vehicle, That's important. It's important to that community, but it's not a priority over the 911 call that's ringing. So now we have our dispatchers say, hold on, I need to place you on hold for a 911 call, place that routine call on hold, pick up the 911, and then return to the routine call. So things like that, letting them know that we're watching and then letting them know our numbers. And honestly, the whole team has pulled together, and they are very excited every week when we post our times because they like to see that they're doing a good job.
Thank you for clarifying that. I just saw something on the news today about the state is going to be looking into municipals and the response times because there's an overall issue across the state, and it's centered around like infrastructure things. So I'm happy that I get to go back and say, we've done a great job. You guys always do a great job, and it's appreciated. And that education and training for your staff. With the last 6 months of staff members who have resigned or changed their status, do you have exit interviews?
So HR is the organization that does the exit interviews.
Okay, and then when HR does their exit interviews, that feedback goes back to supervisors?
Yeah, depending on what the exit interview entails. Obviously, if it has to do with money benefits, it's more of an HR contractual thing. But if it's operational, then HR will close the feedback loop and let us know.
Okay, and to your point, all of the personnel that left are now staying on as part-time. Is that what I heard?
Yes. Well, they have all requested part-time.
Okay.
We have not accepted every single one.
Okay. Just as like a general thank you. I think a question for Mr. Ciccarelli. The 911 dispatch versus when residents are calling in to report, the general line that people call. Could you explain that process? And are those numbers reflected? They're separate from the 911 calls that you're describing?
Yes, they're separate. Those are, general, usually administrative calls, looking for information, documents, information on when a parade is going to be, etc. But yeah, they're not reflective of those.
Thank you.
Okay, any also questions, Ms. Whittam?
Just a quick question. The payroll number for 2026, the proposed, is that, the budget was obviously put together a while ago. Did that reflect the salaries of the people who have left? Does it, and what are we looking at going forward? Are they higher or lower or whatever?
Sure. So we were fortunate to have some very experienced people come in. So we like to try to bring them in at a little bit of a higher step. But we did budget for the people that are already there. So we are in a good place. And obviously we budget for the position, not the person. So we are in a good place. I ran the numbers, and we're in a good place for fiscal year 26 still.
All right. Any other, Mr. O'Neill?
Yeah, good evening. So I have two questions. One, with the shift differential, can you explain the difference, from last year of the 1771 and a, $2,000 increase to 3,900?
So the numbers you're looking at, I believe, are the 1771 to 3,900 as far as the shift differential. So a lot of that is contractual. In the contract, which is up this year, they received an increase in their shift differential from, I think at the beginning of the contract, it was like $1.15 per hour, and now it's up to $1.30 per hour. And that is reflecting anytime anybody works evenings or midnights, they receive an additional $1.30 per hour in order to accommodate that benefit. So they get extra shift differential. It's not much, but it does add up with 13 employees running a 24/7 operation.
Okay, and my second question is under the outside service, same thing, from 966, and then you're asking for 2,950.
So the outside service takes care of radio service needs, technology upgrades, and so we are looking to expand on our current consoles that we just upgraded. and things have gotten more expensive, such as headsets. The headsets that we use are made here in America. However, the bases that we need to connect into the console are not. They are made either in China or Mexico, and the cost for them has gone up. In fact, during COVID, we really couldn't even get any, to the point where we started fixing them on our own because we just wanted to make sure we had that. Now, we do have a backup, which is a cord that connects into the console, but the dispatchers prefer the freedom to be connected wirelessly, so they can get up, grab a glass of water, grab a cup of coffee, grab a snack, and come back to the dispatch center without having to take off the headset. So that's part of the technology upgrade that we're looking to do.
Thank you.
Thank you.
Through you, Mr. Chairman.
Any questions? Gentlemen, no? Okay. Go ahead, Ms. Sheik, and then we'll try to wrap up with dispatch.
Yeah, thank you. Just for clarification, the shift differential, 2025 was $23,200. 2026 proposal is $25,904. The next line down was uniform maintenance. Yeah, for 2024, which was $1,771, to 2025, 3,900. If that, just to clarify, Councilman O'Neill and dispatch, we're talking about the same thing. Follow-up for me would be education, the education line. 2025 was $5,100, and 2026 is $4,400. You just gave a great update of the improvements that you've made to your said department of the education and training. Is $4,400 an appropriate number? I'm just wondering what the rationale is between that difference of decreasing.
No, that's a good question. And it's good that you noticed that. So a lot of the tuition reimbursement comes out of that line. So we have in the contract a tuition reimbursement. Two of those dispatchers that I mentioned that have gone on to different jobs, we're both using it every single semester. Now we have one dispatcher who's using it, so we were able to project a decrease in the overall funding for tuition reimbursement. We are continuing with the same level, if not more, of training.
Thank you for the clarification. And then per employee, is there a difference between a full-time employee versus part-time of what that reimbursement can be for education?
For the education tuition reimbursement, the part-timers are not eligible for that. It's full-timers only per the contract.
And what is the definition of full-time? How many hours is that?
40 hours per week.
40 hours.
40 hours, full-time.
36, it's 40.
It's 40, yep.
Thank you.
All right, excellent. Dispatch personnel, thank you for being here. Enjoy the rest of your evening. And if you have further questions, we'll reach out to you. And again, thank you for your time.
Appreciate it. Thank you all very much.
Can we bring up EMS next? Okay. Excellent, thank you. All right, good seeing you, Mr. Giusulo. If you wouldn't mind, just so that everybody's aware, just kind of state what your position is with EMS, and then go ahead and present your budget, and we'll be asking questions.
Certainly. Good evening, Mr. Chairman. Thank you for your time. For those who don't know me, I'm Kevin Giusulo. I'm the administrator of EMS. Essentially, that functions as the equivalent of a deputy chief or deputy director for police and fire. I'm here tonight on behalf of Director Louise, who could not be here due to a health issue that landed him in the hospital, so he sends his regards. But I'm prepared to answer any questions that you guys have, and I'll open by stating that for fiscal year 26, we're proposing a 2.48% increase, which is on page 64 of your budget workbook, and that comes with a net wash on our expenses and our revenues, so there's a neutral budget increase proposed for fiscal year 26. Some highlights for calendar year 24, we responded to 8,369 medical calls for the town of Stratford. That was a slight increase from the previous year. We decreased our mutual aid usage, which means we didn't use outside ambulance services to cover our calls at a decreased rate compared to the previous year. Additionally, we did have some attrition like the dispatch. I'm pleased to report that as of 2 weeks ago, we did make full-time offers to positions 9 and 10 on our full-time side, which are in the process of being accepted. When that's completed, we will be at full staff for the first time since around COVID. Additionally, as many of you have asked and answered privately, we do rely significantly on per diem personnel to staff a majority of our department. So this past year, we forged a really good partnership with the University of New Haven, who've created a regular pipeline of emergency medical technicians who come on board throughout the year, particularly during times that school's in session. That has led to a lot of brand loyalty, and in the program itself, we're seeing a lot of influx from University of New Haven. That's helped stabilize our staffing this past year. So without further ado, if I have any questions from the council, I'm happy to answer anything that you have.
Thank you, Mr. Giusulo. Any questions? Go ahead, Ms. Sheik.
Thank you, Mr. Chairman. I have questions for myself, and then Mr. Frier is not, Councilman Frier is not feeling well, so I have questions that I'd like to ask on behalf of him. First of all, thank you for all the work that you and your entire department do for our town. I'll lead with his questions first, if that's okay? Okay. Could you explain the ambulance fee and how it's calculated?
Certainly. So the ambulance service fee is not set by the town of Stratford at all. It's an annual request that we make to the Department of Public Health based upon the town's finances, the department's operating expenses, and that's submitted on an annual basis. There's two ways that we can submit it. One is through a short form process, which is what the state implies. It's a very quick and easy process, and that typically results in a low set rate, typically a 2% increase on whatever our rates are for the previous year. And then once every 3 years or upon a General Assembly special condition, they allow us to apply for what's known as a long form, which we've received anywhere between a 6 and a 10% increase depending on the year. This past year, the state came back on the short form process and was going to give all the departments in the state the 0% increase, despite the challenges we were seeing on inflation and the supply chain. And we've applied to the long form process, and we received a 7% increase. We plan on taking advantage of whatever the state makes available to us this year with regards to those processes, and typically whatever is the higher number on the short or long form is typically the avenue we pursue.
Thank you. In regards to the ambulance fees, are there discussions regarding what happens in the event of Medicaid being impacted on the federal level and then to the state, and then reimbursement rates?
Certainly. So thank you for the question. That's actually the number one thing on Director Louise's mind, who would have been here tonight. He sits on the Connecticut EMS Advisory Board for the state of Connecticut. I believe actually he's seen you and some of your colleagues up at Hartford with this. At the federal level, a lot is unknown other than the continuing resolution that was passed a few weeks ago did continue the ambulance rates through September. We don't currently have any indication whether that will or won't continue after September. And he is working through the Connecticut EMS Advisory Board, Senator Onwar's office, and the legislative delegation to hope that the state will maintain those rates as well for next year.
We're with you. And then in the event of a shortfall from the feds, with the town contribution is $450,000. Are there discussions of, in the event of, I don't know if we want to even refer to it as like a contingency plan?
Well, every year there's a contingency plan because
right, but
we
just
don't
for
reach
EMS.
it, so
Just for EMS.
yeah, and I mean it's a tough conversation to have because there's what ifs all around it.
Sure.
And I can say, what if the state fully funded to our request? We wouldn't have shortfalls year over year over year for the last 5 years. We wouldn't be in the predicament we're in right now if the state funded the short or the long term to the right level. So now we're having a conversation about what the feds may or may not do with the Medicaid reimbursement. It doesn't change the outlook for Stratford one bit, because at the end of the day, if we're going to operate EMS, we have to fund whether they're operational positive or operational negative. So it's certainly nothing I would put into play for this budget. I would wait to see what the new rules of the game are and what the playing field looks like, and we'd certainly have a conversation, notify council with whatever plan we have in play. But I think it's a little premature to go through different scenarios where, we would worry about the revenue coming in on the state side or the federal side or whatever, and have conversations about how it's going to come. Eventually, it all boils down to the town of Stratford's fund balance, which is where we've been for the last couple of years. So I don't think it doesn't change. It wouldn't change operationally anything we have. We wouldn't be scaling back services and not receiving calls or taking calls. I think it's one of those things where, it's a wait and see.
Well, my question was, in the event of if there is a direct impact, 25% of the state's budget is Medicaid funding, so of what the state is actually contributing. So for the town, I've gotten questions from constituents, people who are concerned just in general, and I think it's absolutely warranted to be able to ask the question and just to know that, yes, we do have communication. There will be an intervention, mitigation. We will cross the bridge when and if we get there. It's not to say that it's just a pie in the sky of a situation. It's a matter of when, not if.
Well, it could.
I don't want to get into a philosophical
I
debate.
know, but it could work both ways. The whole idea is more money is supposed to come back to the states. That's the premise. That's the second part of all these conversations we hear on the news, no matter what political channel you're listening to or what reports come out, the second part is the end result is cutting back waste, fraud, abuse, and having that money directly come back to the states. And our hope is that we're having a conversation in November, December, that, hey, we got more money here. The state's going to be giving us more money because they're getting more direct access to this money coming from the Fed side as they reduce whatever they're doing on this. But we have to wait to see what happens. So
The other thing I would point out, if you look at the first line item, ambulance services fees in our budget, we did not budget a planned increase for January 1 as we've done in previous years because we don't know what that is.
Right.
So whatever that number is significantly conservative. So if you were to do a 3.7%, which is what we got last year on a long form, on top of what our ambulance service fees based upon our 20% Medicaid mix, we'd be able to manage that issue and then obviously work with the administration accordingly.
And the other interesting point too is that 450,000 is not just a generic number. It's a number based on opportunity costs that the service did not receive because they're giving benefits out to the town. So if we had to pay more, it would still be in line with that type of function and operation. So.
Thank you, Mr. Ciccarelli, and thank you for your comments on, I think, a little bit more background. The 83,000 that you had referenced in the beginning of your, I guess, summary, could you just repeat? Was that how many people are being served? Could you?
I'd ask you to repeat what you're referencing. I don't recall saying 83,000.
So in the beginning of your statement, you said roughly something about 83,000. Was that how many people are serviced?
I referred to 8,369 medical calls. Correct.
Thank you.
Yeah, no problem.
Huge difference.
Oh, yeah.
I worked night shift last night, so I'm still like, apologies.
No problem.
That's it for Anthony. If anyone else has questions, then I'll ask more.
Okay, go ahead, Ms. Whittam.
Yeah, I have two questions. One is simple. How many ambulances do we have that are functioning and used?
We own 8, and typically a combination of vehicles under maintenance and vehicles that are staffed, all of them get used on a regular basis throughout the week.
Okay. And my second question is, for other miscellaneous revenue, it was audited in 2024, 12,435, and then the budget for this year was 50,000. Are we anywhere near 50,000 this year?
I'll follow up with you on the exact number of where we are. I don't have that in front of me, but what I will say is we've done a couple of initiatives. One is our education and training program. In 24, we worked for part of the year without a supervisor in that role, where that was their primary function. That was a replacement position. So this is going to be the first full year that we have somebody working exclusively in that role, primarily bringing in outside revenue. The second is we began charging for athletic standbys and special things that we have been doing in previous years. We actually just received our first payment a week or two ago for about $4,000. So all of those things are what would go into that other miscellaneous revenue item.
Thank you.
You're very welcome.
Mr. O'Neill?
Thank you, Mr. Chair. Oh, did you want to go? Oh, okay. So yes, I have some questions. And trying to look between, I guess, both of these books. So we're still doing the enterprise funds, correct?
Yes, sir.
Okay. So how are we doing in regards with the enterprise fund? I mean, are we making money with that? Because I'm saying, and the reason I'm asking that question is because last year, we were in a deficit, and been in a deficit for, I guess, back a few years. Okay. So, if it doesn't make sense, what I'm saying, to keep running a deficit every year, we need to do something differently, So if the enterprise fund is not working for us, what I'm saying, then I think that we need to do something differently. I mean, that's just where I'm going with this. All right. So, I mean, if you want to say anything before I continue, go ahead.
Yeah, so sure. So what we've experienced last year is nothing new. Since the inception, which was in, I believe, 2003, that has always been a struggle of the enterprise model, particularly because when an ambulance bill is sent out and the way that the ordinance is written, it provides the resident with a maximum amount of protection to not be liable for a bill. And that's unusual for a couple of reasons. One is there are no other towns really around us that operate in that way. And I would say that another way to look at that problem, Councilman, is the way that the enterprise model works is it funds roughly between 85 and 90% of what the department actually costs overall, which means that the town's only making a 5 or 10% contribution to run operations. And if you look at some of the adjacent communities, let's say Trumbull, for example, their multi-million-dollar operation costs 100% on the back of the taxpayer. That would be one of the correlations. If the council and the mayor decided to revisit the enterprise model, that's something I'd be love to have a greater discussion on. But that would have to be done offline because that's a very loaded issue.
Yeah, because actually, when you said it started in 2003, I was actually on the council that passed that. You know what I mean? And I think when we passed it, it was new and we were making money at that point, So I guess the further we get down the road and stuff, the less money we're making for different reasons, I understand.
Well, yeah, there's three reasons for that. One is it was a volunteer-heavy organization. The coverage rate of calls were in the 70%. We're over 90% now. Not all of the cost items were integrated into the EMS organization at the time. A lot of the fringe benefits were paid at the state budget time. So, you're developing revenue stream that really wasn't there because the town was still paying part of that cost on the town side. So once, their coverage increases is what we want to do. Once we have more of a professional organization now, because it's hard to get the volunteers now because the volunteers want to work only certain times and it's hard to integrate them into an operation. And thirdly, when you now bring in cost centers that weren't there originally, that's where you don't have the positive revenue stream from.
I'm aware of that. Thank you. I try to get volunteers for Pop Warner and it's hard. People don't want to do nothing for free no more.
And that's football.
Yeah.
Yeah, and if anything, you're going to get football.
I get it, So I'll just ask two more questions and I won't go through everything that I really wanted to go through. So are we making money or are we minus like we were last year?
So one of the things you have to understand about ambulance reimbursement, like all of healthcare, we budget on a best case scenario in a conservative manner. So when I said that number of 3.1 million was that conservative number, our revenue and accounts receivable sometimes stretch out 6 to 12 months. So in order to give you an accurate snapshot, there have been some years that we've come within a $50,000 to $100,000 striking distance of that number, and there have been years that we haven't. COVID in particular was the biggest contributor to where we are. Anytime a Stratford resident is underinsured for any reason, that's ultimately a cost that the enterprise and then ultimately the town encumber in some sort of way as the benefit of protecting the resident. So where we are right now is I think where we expected to be, predicting where 911 calls are going to be and trying to maximize the revenue on that. If you'd like the precise number, I can get you that offline through Larry or Chris.
Yeah, I just want to know if we're making money or are we still, down that rabbit hole. Again, thank you for saying that you wouldn't mind sitting down, with, I guess, the mayor's office and maybe the council to discuss, the pros and cons of continuing with the two type of fundings. All right, thank you. That concludes my question.
Ms. Sheik?
Thank you, Mr. Chairman. On page 64, the last two line items, disposal fees and then hazardous waste. Could you just explain those two line items?
Certainly. So account number 6401, disposal fees, because we're a healthcare regulated agency, we have to dispose of certain contaminated items in a very specific way, which is regulated. So the $3,500 cost used to be around $10,000 years ago, and we've worked with the administration to negotiate that cost down to a very manageable number. Account 6402, hazardous waste, that is an underground tank that is on the front of our building that has to be pumped out annually, and that adheres to, I believe, DOT regulations with oil separation with washing the ambulances. And it's a flat rate depending on the volume of water that's taken out of that tank.
Thank you. And then I just want to go back to staffing. So on page 65, it says headcount full-time, that has 16.0. And then I had similar questions, and you alluded to it in some of your comments already about full-time, part-time, per diems, EMTs versus paramedics. Do you have available the breakdown of how many full-time, part-time, per diem EMTs we have versus paramedics?
Certainly. So I can speak directly to the full-time first. We have 1 administrative assistant. We have 10 full-time paramedics to make 11. We have 3 full-time operations supervisors who double as paramedics in a supervisory capacity. And we have myself as the administrator and then the director to make the 16 full-time positions.
And then what about part-time staff?
So we have no part-time staff. We have per diem specifically.
Okay.
We have 2 categories of per diem. We have per diem paramedics and we have per diem emergency medical technicians or EMTs. We typically fluctuate between 6 and 10 on the paramedic side and anywhere between 25 and 35 on the EMT side on a rolling basis. As Larry alluded to, we have the same issue with the per diems that we do with our volunteers, whether they're going back to school, they graduate, particularly because we rely so heavily on those, I'm not going to call them seasonal employees, but frequently, attrition positions, because they either go on to pursue careers elsewhere in healthcare. Nursing is one of the big areas that we lose people to, physician assistant programs, or they become paramedics, and if we have a position available full-time, they certainly have the first opportunity to apply for those, as would anybody, but typically we lose them to better or other careers elsewhere in healthcare. And then volunteers, we have approximately 20 to 25. That number is one that we struggle with very often, because when we get somebody in the door, especially based upon the current economy that we're in, they typically like to move to one of those paid roles as soon as possible for what I think are obvious reasons.
So with the fluctuations of staffing, how much does it cost to train and onboard a per diem versus?
So there's a fixed cost to do the background check, the physical, and everything that the town has. I would direct you to the HR department to get that precise number. Training itself, they all come pre-certified or pre-licensed to us typically in order to qualify for the job. And depending on their experience as well as passing certain criteria that the hospitals impose upon us, those costs are really very variable. Some people have no cost if they come with experience elsewhere. We might train them in a very fast way, 1 to 2 weeks with a trainer, and any cost would be whatever a shift differential or training differential would be to partner them with somebody in a field training role. If they require more advanced training, and that goes on longer, the cost just multiplies by how long it really takes. So it's really variable. Someone's new and has no experience, we might have them on the road in 8 to 10 weeks typically.
And then with recertifications or new certifications that said staff might have, do the employees have to pay for that upfront and then they get reimbursed, or does the department cover the cost?
For the most part, we cover all the certifications that's required. So if you're familiar with medical control authorization, that's our relationship with the hospital, and they're the ones who set that criteria. And all of those costs are covered by the department, whether you're a full-timer, you're a contract, or our volunteers who work for free, and everybody in between.
Thank you.
Mr. Green?
Thank you. Through the chair, thanks for all the work you guys do over at EMS. It's tough, I think, the enterprise model, but it seems like you guys try to really, make sure you have a high quality service that still is run very well. I appreciate in particular the notes that you have at the bottom of page 65 to give us some context for some of the lines, and in particular, letting us know it looks like that on the bonding debt, line 6902, line 6921, that's actually something that's expiring middle of this year, going into next year. So what was that, and do we anticipate any other need for bonding?
So the bonding was the original renovation purchase of the building on Main Street. That actually predated my employment with the town. I want to say that was around $2.5 million originally, and the enterprise budget in front of you has always included that cost as something that we are grateful is expiring next year.
So that will, to the point of like trying to float things, that's going to give you guys some wiggle room. And then the other thing I see here is that it does look like, you guys are targeting a higher pay down of the deficit with this budget than in last year, right? That last line item, fund balance deficit, the idea is you guys are targeting a budget that pays down that deficit by $175,000. Is that the idea?
Yes, that's the idea. And then we actually improved overall about $500,000 from 23 to 24 for the audit, which was passed out. So we are moving in the right direction. These guys do a great job. They're incredibly meticulous on the proposals we get and how they manage it. I think it's wonderful that it's classified as a fund balance. I think it's unfortunate that it doesn't get the same category as other departments in the town, where they're not held to the same standard of breaking even, because at the end of the day, Stratford residents want the excellent service, and I don't want anybody to call 911 to have these guys come out. I want them to make no money, right? I want healthy residents not calling 911, and when they don't call 911, they don't make any money. So if we have a Friday night where there's no calls and nobody needs an ambulance ride, I'm not going to break, my heart's not broken that we didn't come in at any revenue, and it's certainly unfair for Kevin to be sitting here, or anybody from EMS, saying, hey, my budget doesn't balance, what can I do? And I'll be like, well, that's the same thing as you rooting for people to call 911 to have the budget balance. That's not a fair position. That's not what we're doing here. So we offer an excellent service. We're as close to neutral as we can. We strive for that balance, but it'd be like saying, hey, I want the library to balance on overdue fees. Like, it's not right. So I think they do a great job, and this is a really good budget we put together, and we are moving in the right direction with paying back the fund balance, paying down the fund amounts.
One other point too, what they do is unique and deploy their assets based on historical documentation for calls. So they're not configured, people just sitting there or not doing any work. Every day they report based on how they're configured to match the historical numbers for calls at certain times of the day. So what Chris was talking about, one of the reasons to get to that efficiency is making sure you deploy assets when needed, rather than just assets just sitting there.
Thank you. Yeah. So again, it seems like you guys are providing good service and doing what you can to keep things in line. Thank you.
Thank you, Mr. Green. Mr. Glad?
Yeah, just one quick question. I've asked a number of our departments this. Will you guys be able to provide the same level of service with this budget in front of us today?
Yes.
Thank you.
Okay, seeing I've got no further questions for EMS. Mr. Giasulu, thank you for your time. And I guess continuing alphabetically, and because there's more of them than there are police, I'm going to bring up the fire department next. Sorry, Chief.
Good evening, everyone, members of the council. Fire Chief Atkinson, pleased to present our fiscal year 26 budget. I'm joined by our administrative team. As many of you know, we've been without a deputy chief. We've been going through that employment process, searching for a new deputy chief operations. Our chief officers, our assistant chiefs that I have with us here today, they've done a tremendous job in stepping up to the challenge that we have to manage the fire department together. This is part of their process. We're working together. Okay, excuse my voice too, I got my water with me. But they've done a tremendous job working together as a unit to continue moving the services forward of the fire department, helping me administer the fire department. Our overall budget is relatively flat. Maintain consistency is what we've had in the past few years. I reviewed this and I think that it's a very good budget. I think it balances the needs of the departments as well as the services that we're able to consistently provide. Over the past year, our call volume has been relatively the same, averaging a little over 5,000 calls a year, emergency calls. Our fire prevention department has done a great job inspecting buildings, current as well as new occupancies, plan reviews, in order to provide safe buildings for the town as well as the firefighters and their safety. Our staff together has done some amazing work. We have a young staff. We have a new model that we're trying to incorporate different levels of the department to work together and to move more projects forward. Some of the things that we're able to do that I'm really proud of is our alternative PPE that we were able to fund, our regular turnout gear, our driver training, and the technical advances that we've made with confined space, elevator rescue, and the department has really worked together well with the training department, building that OSHA requirements that we need to have done, as well as interesting training to keep our members safe. When we work on our training programs, we look to keep our members safe, to keep them operating in a safe environment by training them, giving them the right tools that we have, and we've got a lot of good ideas that have come forward that we've been able to fund with the support of the town as well. Over the course of the last year, we've had 2 people who've retired due to their reaching their retirement age, and they've retired healthily. They were healthy, and they were safe as they retired. Tongue twisted my words. We've had 1 person who has departed for new opportunities, but we are staffed at our full level according to our contract, which I'm proud to say. We have 2 new promotions, so we have growth and movement through the department, which is something I'm really proud of. And probably one of our most things that I'm proud of is our TAC 5 that should be hitting the road soon. So with those points, I'm happy to answer any questions that you have for any one of the 3 budget items that we have here.
All right, thank you, Chief.
I just have one question. Is a retirement age a mandatory age? Like do they have to retire after they're 50, 60? Is there something like that, or no?
The town doesn't have that, but when you reach your 25 years, people may choose to retire at that point. Or some stay.
Hopefully they stay.
That's it.
Mr. O'Connor.
Through the chair, thank you. Just want to ask, thank you, Chief, for all of your hard work and obviously your whole team and keeping us safe. Do you feel that your budget is adequate to continue keeping Stratford safe and your team safe?
I do. Our team works together really well. They find deals on everything. So what they do is they find these deals and they bring these opportunities forward, and they develop relationships in order to help us receive services through outside vendors, through training, through learning. So I do honestly believe that this budget will help us to continue to provide top level services in the town.
Thank you so much for all your hard work.
Thank you.
Mr. Green?
Thank you. Through the chair. just echoing fellow councilman, thank you for the hard work you do to keep us safe. Thank you also, as a member of public safety, we definitely get to hear a lot of the details and how you think about always looking to improve the department and keep things moving forward. You mentioned that the department is fully staffed per the contract, and I see here that number has been 93 as far back as we go. How do you determine that that is the appropriate level of staffing?
Well, we have a minimum staffing clause in our contract, so we look to maintain that through the contract. As we project new budgets, we look at people who are retiring and project where they'll tell us, they'll usually tell us, and they're honest with us, they tell us that they're going to retire, and we're looking to get people hired ahead of that time frame, so that way we're not operating at low staffing levels. So as we looked at this year, the people who retired, they told us they were going to retire. We looked at the people who were entering that retirement age. So we put a projection forward as to what we need according to the contract, and based on the timing of the fire academy, where we can get new members trained up. So it's a projection that we use. It's not always foolproof because people can stay, but we look to fund based on what the contract gives us.
So so you're targeting that minimum, that 93, give or take. I guess my question was, how do we know that that 93 allows our department to operate, as effectively as possible?
I would say, as we go through the collective bargaining process, we work with the union to determine staffing levels. We look at different OSHA mandates to see what our staffing is to be able to fund that.
It's essentially, hey, how many people are on this shift? How many people need to operate the apparatus times 24 hours a day, 7 days a week, and you come up with a number, and that's where we ended up at.
Yeah, to Chris's point also, it revolves around the probability of what we would incur. On a fire side, it's a service where what happens in the town, what type of buildings we have, how long does it take to get from point A to point B, and all that's taken into consideration for staffing levels.
And one other thing I'd like to add too, I mean, this isn't, the fire budget covers employees' costs, operation, utilities. The fire budget is really defined by what new items go into the CIP program. That's the big issue, more so than the operational. The operational budget's here. It covers all of our basics, everything we need to fund the department. As we continue to think more and more outside the box about first responders, we keep looking at different types of equipment we need. We keep looking at different ways we can fund it. I know Chief has been in my office several different times about items or deals. It seems like you have
We got a shovel ready whenever there's something going on.
Yeah, there's always something. There's always one option he has. It always seems like it's coming from some outsourced place because he knows a guy, but he's doing a good job at that.
I definitely appreciate your creativity and innovation on that infrastructure capital side, and get to see that through the work we do on public safety and the work we do on the capital improvement side. I guess, right, when it comes to the staffing, when I hear the minimum and when I look and see that almost, compared to the regular payroll, almost 50% of that is again in callbacks. I'm just concerned for that amount. I know they do 24-hour shifts. That's a long shift to do. And I just look at that ratio, that it's been static through all this, and I understand that that's how it's been working, but especially from a safety perspective, from a sustainability perspective for them, I'm just curious if you guys are doing any analysis on if actually that number 93 as a minimum is actually the best number for the town and for the firefighters.
It's a good question. I'd be happy to look at it, happy to review it as we go to the collective bargaining process. We always work together with the union on that as we do our negotiations. That's what they are. But also, I would say when we look at that in our contract, we do have time provisions where you can only work 48 hours at a time. So that way people are rested and they're not operating we've in an unsafe manner. We follow the FEMA rules on that. So that way that's a national standard that we would compare that to. But that's definitely something that we look at, the rest and recovery of our firefighters, because we realize that they're outside during inclement weather and bad situations, stressful environments. And we always work with people to check and make sure they're doing okay. I think our chief officers do a great job of keeping tabs on the men and women of the department to make sure that they are doing well. They can be assisted if needed.
Thank you.
Ms. Sheik?
Thank you, Mr. Chairman. Chief, good to see you. I guess off of what Councilman Green was asking, you know, the 93, 93, 93, in the conversations that you've had with the union, what is their feedback for staffing?
As any fire department, we'd always look for more. That would be the feedback I would see. I would love to hire a giant fire department full of people. Unfortunately, we're bound by cost limitations sometimes. But I always look for more ideas to do that when we do have opportunities or things that we need to have additional staffing. I make sure we do call for them. I don't hesitate in doing so and preparing for emergencies or events that come up that are out of the ordinary. We always look to do that, and there's never been a problem with staffing those positions for those emergency positions as needed.
Let's also take into the reality that when we look at the overtime, not to attack overtime, that's money our employees are counting on. It's part of their, their W-2 at the end of the day. So the more people you add, the less the opportunity they have for take-home pay, which is also in the contract too. So if you go ahead and you add, an extra 10, 12 people, however that would base out how many people you want to add per house, total number of houses, times all that shifts, you get to like a number where you're 8 to 12 people, all of a sudden you're reducing, our current 93s overtime or W-2 at the end of the year, and they're working, but they're making less money. So it's something we have to consider, and I know this town has always worked hard at protecting the overtime for that.
So the question was not to inquire taking away earned income from the firefighters. The question was in regards to if they have the staffing needs that the actual firefighters would say, yes, we do have enough staff, or we don't have enough staff. That was the simplicity, I guess, of the question. It wasn't tied to infringing upon potential income.
So I would say because
be very clear.
Because it's a 24-hour service,
Correct.
we would call people in if we needed staff for a major event.
Right.
We would call them in, right?
That's emergency services.
Right.
Correct.
So
Right,
I
well,
mean,
we do have mutual aid.
yeah.
I mean, that's the, in fact, I was with the state today and all the fire departments in the state, and, they're all interlocked with that mutual aid number. Not any municipality can weather the burden of the additional costs of all that equipment. So the mutual aid concepts for those rare times when something's extraordinary. But to Chief Atkinson's point, we've deployed more than our minimum staffing for a given event when need be.
Right.
So we would take mutual aid and more than 22 or 23 on a scene if need be, especially if it was right around shift change. We just bring the other shift in on time or early, and the shift is supposed to leave stays. So if it's still all event driven. So never we had a situation we didn't have enough staffing to handle a scene, either through us or through our mutual aid partners.
Thank you.
Go ahead, Ms. Whittam.
What's the call volume that you have there? How many calls do you have?
Our last year's call volume was 5851, so 5,581 fire calls. We're averaging over 140, between 100 and 140 inspections per month for the fire prevention division as well. So we've pretty much, sometimes we fluctuate based on the nature of emergency calls. It may be up a little higher, maybe a little lower, depending on what's happening, but it's averaging around between high fives, low sixes, in the thousands for calls.
I notice also that anytime you see anything on Facebook or wherever about a fire, it always seems to be about 22 firemen. And when I had the fire at my house, it was on the site as 22 firemen. Is that how many firemen are on at one time? all the different?
Yes, it'd be between 22 and 23, which is our normal staff shift. But there are times where we have people doing additional work that are available to respond to calls, or we may call an additional command staff to run an incident. So there may be more. I usually use boilerplate language when we're doing press releases to start with the minimum of who we have and add as needed based on the incident.
And then based on the proposed budget, do you think you can maintain the level of service that you're providing now, which I think was great because I had a fire.
Thank you. We sure appreciate that support. Yes, I do think so.
Thank you.
Mr. O'Neill?
Oh, sorry.
Sorry.
I was going to say, every year I try to make a pitch. I know I go to the chief every year. I'll do it again. For anybody who may have conversations at the state level, I think it's incredibly unfair that we don't get reimbursed for going on the highways. We send our trucks out there, our personnel, we have to call in overtime to cover car accidents on the Merritt Parkway or I-95. I have nowhere to submit a bill for that. The town of Stratford incurs all the costs to cover state highway systems to make sure that, residents from Virginia or where, out of town, I think if we're having conversations at the state and we're having conversations about fairness, there should be an ability for all towns who are on the highway system who pick up that burden on behalf of the state of Connecticut to have some reimbursement option. I've been saying it for years, and if someone's listening out there, I do hope we can move in that direction.
Through you, Mr. Chairman.
Okay, go ahead, Mashik.
Thank you.
How
Just
about
general.
Mr. O'Neill?
Oh, did you hit your mic? Did you hit your mic? You can go.
Yeah.
Sorry, go ahead, Mr. O'Neill.
I just let him because he wanted to say something when he called me to speak, but I let him go ahead
Go
and
ahead.
finish. Thank you. I talk slow, you said? Oh. Yes. No, so first I didn't have a question, but Mr. Timiak, you put a question in my mind. When the firemen are hired, okay, do they know that they're getting a certain hourly rate or salary? I'm just asking, do they know that?
Yes, it's, I think, is Ron still here? Yeah, when you hire a new firefighter, I don't want to speak, but there's a whole step wage scale. I know I'll just pass it to Ron to talk about that.
Yes, all firefighters will know what their starting salary is. They have a certain salary they start at before they go to the fire academy. Once they graduate from the fire academy, they get another increase based on their certifications they have. And there are additional certifications the firefighters can obtain over their time of being employed, and they can increase their salary based on those additional certifications, like a pump truck operator. They get additional monies for that certification. Not if you don't have it, then you don't get that additional. But if you do get those additional certifications, you can increase your salaries. They're well aware of all the benefits the town has, the medical, the dental, retirement plans, contributions that they have to make to anything. Then we go over everything that they are entitled to, their holidays that they're entitled to, sick time, vacation time, pretty much anything that's the benefit for the contract is what we'll make sure they all understand that during our orientation, and we make sure the firefighter understands that before they continue, and pretty much once we explain all that to them, they accept that, and then we send them to the academy through the chief.
And so, do you also tell them that they're guaranteed X amount of overtime?
No, we don't tell them they're guaranteed any overtime because overtime is not guaranteed. It's based on, the need. Obviously, part of the benefits I just mentioned are sick time, vacation time. They can use holiday credits as a form of taking time off as well. So every firefighter is entitled to that benefit. So if they take time off, that does create overtime. So it's not just, people working normal hours and never take time off. There's benefits for them. That's what impacts overtime as well. On the overtime budget, people are entitled to those benefits. So they have sick time or vacation time to take off. Well, you can't operate less than 22 people for the contract. So you have to hire people back to get to the 22 minimum manning. So that's where some of your fair amount of your overtime kicks in because people can take off. There is a max of how many people can take off per shift, for vacation purposes, you can only get 10 people on vacation. So if you had 10 people, then you're hiring 10 people back.
Thank you for explaining that. So it gets to my point where Mr. Timiak was just saying that, so the firefighters, if we were gonna hire 8 more firefighters, the firefighters that were gonna get overtime would be upset. Is that what you were, and that's what I'm trying to understand, because, if they know they're making X and they agree to X, then whether they know what they're getting. And to say, we're not gonna hire other people because we want the firefighters to get overtime and get X. That's why I just wanted the clarification. Is that something that is told to them when hiring, that
Well-
you're gonna make this, but we're gonna give you?
So there's two, I mean, your example isn't what I was referring to anymore. So, what I was referring, if we just added people to add people, then, we still have the minimum manning covered. So you gotta, there have to be the change to, I was trying to incorporate it to an apparatus, to a purpose, to say, hey, if this person's not here, someone's gotta cover that spot. The scenario which I was giving, if we're just adding people to make sure that we're reducing overtime, well, then I essentially have someone there who's extra on call to fill that spot. Those are two different conversations, and both of those conversations should come up during contract negotiations. Probably not the best spot to have it at a budget discussion, but I do understand
Thank you.
your question.
So before we continue, I just want to pause here for a sec. I need to step out. Carrie Whittam's going to take over in terms of running the rest of the meeting, and myself and Mr. O'Connor are going to step aside. Mr. Timiak, is there another meeting coming in here at 7? No? Okay. All right. So again, everyone enjoy the rest of your evening, and I'm going to have Carrie take over.
So does anyone else have any questions for the fire department? Yeah, Chief.
Thank
Caitlin,
you, Madam Chair.
for the moment.
For the moment, that's okay. It's good to practice. Thank you, Councilman O'Neill, for asking your follow-up clarification questions of Mr. Timiak's comments. Since you're sitting up here now with the rest of the administrative staff, my next question was going to be in regards to staff that have left. I had asked dispatch, if the exit interviews are done, and what the feedback is, and what changes the administration has made to help attract and retain staff here.
Well, the exit interviews aren't necessarily designed to address, to retain and attract people, to get feedback from the employees if they wish to participate, because a lot of employees don't wish to participate. There's also, before I go into more detail about that, there's also the ability for the individual to say that they want to keep it confidential and not share it. So we respect their requests. So if they don't want to share it, we don't share it. It's just discussed amongst the main administration personnel, not with the department heads, if that's what someone indicates. But sometimes we do have people do that. But the exit interviews are designed to say, what can we do to improve our departments? And we do take that feedback when it's requested that we share it. We do sit down with the department heads or the chiefs and generally share that information to them and say, this is what this person says, this is what their critique is. Some people may have something, and some people say nothing other than, I think it's great here, and it's just time for me to retire, and that's why we're leaving. We ask a lot of good questions to find out from the employee what can we do to keep them and so forth, as well within our constraints of the contracts and the town's economic status.
So what have we done? What has the town done to help increase recruitment and retention here in Stratford?
Ms. Shake, so let's think first off of the tenor of the people that have left. All the dispatch personnel left for management positions. So personally, I think that's a compliment to JP and Heather, how they developed their staff, how they grew their personnel to become managers other places. So they didn't leave because they were disenchanted with Stratford. They left because we helped them grow as individuals and as leaders to jobs in other places. The fire personnel that Chief Axton was speaking about were people that were ready to retire. So, if you also just drill a little deep to see why they left, that's has a lot to do with what kind of attitude and approach they'll have at an exit interview too. So.
Thank you, Mr. Ciccarelli. I appreciate that, but my question was because fire is up now.
Right. I will comment.
Specifically for fire.
Yeah. Let me comment generally speaking for all of our town departments and attracting people. The town does not have a problem with recruiting people at all. The last time we did an exam for firefighters, we had over 300 people apply. We had 250 people take the exam. We have approximately 175 people on the list who are interested in work for the town of Stratford Fire Department. So we don't have a problem in attracting anybody. I'm not sure where, maybe you may have heard that or not, but we don't have attraction problems for any of our departments regarding our hiring here. We've never had that issue. We've always had a surplus of people applying for positions. Mm-hmm. I think our town is very solid from that perspective. We have good benefits. Pay seems to be fine. No one is complaining about the pay and saying, I don't want to work here because I'm not going to get paid enough. I've never had that reply back from a candidate once we offer the job to them. But people do want to change careers. They want to change locations. Their family moves. They have different financial needs, and people do move. So that's normal in any kind of industry or even in any municipality. People move from place to place. It's it's a matter of a choice of the individual. And obviously, no employer is going to be able to change an individual's decision to make a move, whether it's retiring, whether it's just saying, "Up, I want to move someplace else." We can't convince them to stay when that's what they want to do. We don't try to convince them, say, "Oh, don't leave, don't move someplace if that's where they want to move." I'm not going to tell them not to. We want to make sure when the employees do leave that they're bettering themselves. Obviously, as Larry pointed out, it reflects on the whole town. When people leave and take higher positions or improve themselves in any industry. But I will tell you, in the fire department, there is no issues with attracting people coming here. We have, the chief can tell you, we interview 10 or 15 people at a time to hire 2 people. So we have plenty of people interested in work with the town of Stratford Fire Department.
And what about retainment?
Retainment, I think we have very little people who leave based on the fact that they haven't reached their retirement age. I believe there's, like the chief mentioned earlier, I believe there's only a couple of people left. I think we had one other firefighter since I've been here who actually left from our town to go to another fire department. And that was not because of any other reason than they lived in another town and a position open there and they wanted to work in their own town, which I'm not going to say don't do that. That's not my prerogative to do that. So from that perspective, I haven't had really firefighters leave to say, "Oh, I don't want to work here."
Okay. If that's your assessment of.
That's the facts of what happens.
Well, I don't have access to the facts. That's why I'm just simply asking. If people have left, and for whatever department it is, I'll ask the same question to the police department. In their exit interviews, what is the feedback? What have we done to improve? If there's anything that's constructive that we could make improvements upon, because it's expensive, right? And the training, and we could go on and on about this, I'm sure, for a long time. But if that's your answer, then.
Have you heard something contrary? If so, I'd love to hear it, not in this setting. If you could come set up a meeting with me to go over it, I'd love to hear what you're hearing. If you're hearing something different than what Ron said.
I think the overall feedback, which is public, is around retirement benefits in the town. And it's not a secret because we've had public testimony up at the state. Ron has come and testified himself. We've had firefighters, whether they live here, work here in Stratford, or they've left, or other firefighters who agree in regards to retirement options for firefighters. And there's state bills moving through the legislature for police and firefighter recruitment and retainment. My question as a counselor is in regards to, for this emergency department that we have, if and when we have people leave, if they had exit interviews. And to the description of what was shared was people can choose to participate, it's not mandated, and if they do, some are confidential, fine. But if there was additional feedback other than moving or being eligible to retire, those were the two reasons that were stated. That's what I heard from you guys, which is in contrast to directly what I've heard from staff. So I don't think that this is the appropriate.
No, it sounds like
venue.
the state of Connecticut would be the appropriate.
Yeah, I actually don't think that is relevant to the budget right now. If you want to have that conversation separately.
Right, that's why I'm.
Yeah, and let's just move on. Does anybody else have any questions for the fire department? Or is there anything you'd like to follow up with?
I know that that's a difficult conversation. I understand that this may not be the venue for it, but I'd be happy to talk with you all and go over some different options. One thing, just for your clarification, Counselor, I do see everybody who leaves, and I do have a conversation with them before they do get to HR. And I do ask those questions. And they are for a variety of reasons. Some people go for different benefits in different locations. Some people have reached that time and they're tired and they're ready to retire and move on to the next chapter of their life. Some people have had some family issues that I've helped them deal with.
Sure.
So there's a multitude of different reasons, but I make contact with everybody who leaves and offer to assist them on their exit, no matter what the reason is. We help facilitate that move and do that transfer to make sure that they're okay. I've been in this job 24 years. I know all the older gentlemen and men and women of the department, and the new people, I get a chance to meet them in different ways. So we try to make contact with everybody and give that personal touch to them to see how we can improve, be better, or to see some of the things that are out there that would cause people to want to leave.
Yeah. Thank you for that.
Thank you, Chief. Thank you, Larry. Anybody else? Thank you.
Thank you all. Have a good night.
Chief McNeil? Just let us know what page you're starting on.
That's funny. Good evening, everybody. I'll just run over a quick. This budget is pretty tight. There's really the major increases here used to be contractually. That's driven into wages. We do have an increase in the admin side of the house for custodial supplies, $15,000, and also training. Training increases due to contractual. FTO increases, also state mandates, which is unfunded, which we have to pick up. But otherwise, it's a very tight budget, and it does not affect our service whatsoever. They'll still be top notch. And with that, I'll take questions.
Questions? Comments? Okay, let's move on.
Oh, I'll ask them.
Oh, you have
I
one?
didn't know.
I'm
Yes.
sorry.
Thank you. Sorry.
I had my wrong glasses on.
It's okay. Good evening, Chief. It's good to see you. Let me see. Again, I'm going to ask on behalf of Councilman Afrier, who's not here. On page 55 for police traffic, the current workload of 3 traffic personnel in this division, with the new speed cameras that the town will be having implemented, is there any increase to those 3 officers' workload, or does it streamline? Does it impact those 3 people in any way?
We have a total of 4.
Oh, is this 3? I think? No?
So we did move one from patrol into traffic.
Oh, you did?
Yeah.
Okay. Thank you. Thank you. Sorry, you said no?
No, there will be an increase, but we have extra personnel in there to handle it.
Okay, so in the anticipation of the 4th person is to help
Yes.
facilitate. Okay. So patrol officers, how many do we have?
Right now, patrol or total officers, we have right now 106. Tomorrow, we're going to have 107.
Congratulations. And then you had highlighted administrative fees going up as it's a tight budget, but that was something within this budget that's actually increasing.
I'm sorry, Anita?
The administrative fees within the department, was that something that is
Oh,
driving?
yeah, janitorial, because what happened was.
Janitorial.
Yeah, that's just because it's decentralized, so we're picking up the cost of that. We had a partial last year and we're getting full this year.
Okay. And then the janitorial, Mr. Timiak, is that the custodial? Is that separate? It's very confusing, this new
Yeah.
custodial in like
So we
some
are,
departments, not, some of them are in your department.
we're entering year 2 of decentralizing. Year 1 didn't go as smoothly as we wanted. We found out that the anticipated costs in each department was under budgeted last year. So we're trying to make it. And then the other thing we didn't take into account was so when I have a workers' comp who's a full-time, I have to hire a service to cover for him. That service fee can be extended depending upon the length of someone out on workers' comp. So that number actually turned out to be way higher this year, unfortunately, due to a couple of our custodians out on workers' comp. So I'm trying to factor that in, and I'm trying to make it right, but I think it's going to be always something which is just, it's going to be up 1 year, down 1 year. So like until we get, the 3-year average or the 5-year average, it's going to be hit and miss because it is going to be what it's going to be. But that, this is one of those things where the auditors wanted to see it housed in each one of the departments. So we're trying to accommodate the right size accounting for it.
And then same question I asked the other departments, in your evaluations of said departments within the entire department, improvements, anything that you'd want to highlight or share with us from last year into this year, and then in anticipation for 2026?
Well, I think we're pretty efficient. And we're doing well in recruiting. We're getting a lot of good people in. There's a variety of reasons why we lose people. They go to other departments for pension benefits, whatever, but we lose people that go to out of the profession because being a police officer is not exactly, a great thing right now. But we're doing really great compared to our other departments in the state. So, many are down, like 16, 17. We're down 1 starting tomorrow. That's pretty remarkable. So I think that we're a good place to work. We really are. So, it's good leadership, but it's a good town. The mayor's doing a great job. And if you really break it down that way, it's a good place to be. And we're getting a lot of people in. So we're going to be probably fully staffed in a few weeks. And I haven't seen that in quite some time. Almost 30 years I haven't seen that.
And then with Madam Chair, with the staffing that we do have in terms of seniority or people who are new, would you describe the department as experienced, meaning, on said shift you have whatever the ratio is of newer staff to more senior staff, so that therefore, if there's an event or something that there's adequate coverage, meaning you have senior staff that are able to help intervene, help de-escalate, whatever the case may be, to the more younger staff, because we heard from the fire department that sounds like the majority of their staff are newer, younger, less than 10, 12 years of service.
I'll say this. The younger officers get better training now than I ever did, or anybody. Senior doesn't mean better. I think the product we're getting is better, because they know there's a lot more emphasis on de-escalation. Mm-hmm. Now, that wasn't really done when I came on. It is now. We call it something completely different. So the product we're getting is a lot better, and they're in the academy a lot longer. So they're getting a hell of a lot, excuse my French, a lot more training than I ever did, or other senior officers. So that's really not a litmus test. It's really what's happening now in the state, because it's expected more for you to do a lot more. Mm-hmm. That's de-escalation, to be offering all these other services. You are the conduit, and I think these officers we're getting now can do that. They're doing a lot better than I did. When I had to learn on the go, mm-hmm. And I think what these people are doing now is is great. And I think the training is spot on, finally.
That's good to hear. Thank you.
Alvin?
Through you, Mr. Chair, Mr. Chair. I just have one question. I believe you said your opening statement was that you're working with a tight budget. Is that correct? So I'm going to ask you a question that you may not be able to answer. But my question to you would be, if there was one thing, since you know that this is a tight budget, if there was one thing that you think that you needed more, that you would like added to this, what would that be?
I'll be honest, there's nothing I need. We generate revenue, and out of that revenue, I anticipate that we'll be able to do a lot more of making our roadway safer, but that's really not me. That's different. That's a public works issue. So, but the revenue that we draw from these traffic cameras, we'll be able to do that as a town and make our roadways safer. But as far as the budget, I don't need anything. I mean, this gets everything I need accomplished, period. That's it.
Thank you.
Anyone else? Paul?
Yeah, Chief, the mayor's proposed budget, does it cover everything you need? Or will be able to complete your law enforcement mission successfully for the coming year?
Absolutely.
Okay.
No problem.
Chris?
Thank you, through the chair. Just a quick clarification. It seemed like, Chief, you're starting on a page and then we kind of went broad. Were you looking to go through each of the departments, or did you share everything you wanted to from your presentation?
I pointed out any of the increases we have.
Okay, so
everything
that
else
was just
status quo.
a couple. Okay.
And I think Larry technically started that page. He said 51, not me.
All right. Thank you.
Yes, whatever he just said, yes. In order to expedite it, whatever works.
Okay. Then I do have a few questions. You mentioned recruitment, retainment. Dispatch mentioned they had 50 applicants for their most recent position to hire 5. Fire mentioned they had 300 whittled down to 250 to hire 2. I know we're fully staffed right now, but what does our typical applicant pool look like for a position?
We're different because we're doing through policeapp.com, which is larger statewide. So it's anytime we need somebody, we just pull 5 at a time and we go through them. But we also have the ability to give, if word of mouth, if someone says, listen, I have a friend of mine who's really interested, we can give our own test. So we started a two-pronged way of doing this. So we have bring someone in instantaneously, because you have to wait month to month to test with the CPCA. But if we do it ourselves, we do it instantaneously. So that's how we're kind of really bringing people in. And I think the word of mouth are the people that we're getting a better candidate, really.
Is that a new initiative?
Yes, we just started.
Okay. Thank you. You also did mention, I think, and this is true, and I appreciate one of the first things I got to do when I got on the council was go for a ride along with one of your officers, Officer Ides, and really got to see firsthand the commitment to community policing, to doing all the little things, and to understand what a tough job it is. So thank you for that opportunity. And you mentioned that I think the training has really stepped up in terms of what an officer gets today. And with it, though, there's also a rising cost to training a new officer. Do we do analysis on making sure we're working, not just to have the head count we want, but to make sure when and where, officers are leaving, if they have specific concerns about thinking about that cost of that officer leaving when it comes to the fact that somebody new coming in the door, even if there are a qualified candidate, is going to have to go through all that training.
Yeah, but you have to look at it this way. We always lose people to retirement and everything. That's just the natural course of business. Plus, we're dealing with a whole new wave of people that don't have a loyalty to an agency like the older folks do. I mean, that's just the way it is. It doesn't affect us, really, because we expect it. Now, back in 2012, we only had 88 officers. We fell down completely because we lost a lot of people. We weren't replacing enough. So, we're not suffering a mass exodus at all. We are seeing people retired, and we try to plan for it. It's harder now because, we're just not seeing people really wanting the job. We bring people in sometimes, they're like, it's not for me. because of what they have to go through. Not so much the training, the scrutiny. I mean, you're one incident away from, something very bad happening, like losing your house or losing your freedom. So that's our biggest, try to change that. If you look at that police accountability bill, it's pretty scary when they say, you know what, if you do something wrong, you personally are going to be held liable. That's a very scary thing. So that was a big problem for us. And I think every single department, in the state, honestly.
And I know there were some initial imperfections in that bill that I think even our local representatives worked hand in hand with you to improve. Are you saying that in its current state it still is a major concern, or is it?
I haven't seen improvement.
Okay.
We still could be held personally accountable. We could be sued personally.
All right.
They basically throw it on the town.
Mm-hmm.
And we haven't really defined what wanton, reckless, and negligence is. I mean, not in the bill, right? So, or losing public trust. What is that exactly? So, until that really know what it is, you got to be careful. But the training that we do, the training that we're focusing on, is to ensure that the officer comes out, shows empathy, and has a whole catalog of options to it. That includes everything, non-lethal to verbal to services outside the police department, social workers, all combined together.
Thank you. Speaking of the great services you provide, PAL is a phenomenal program. I know that I think we're probably have one of the best examples of how to implement that in the community around. I saw in the administrative a line item for PAL for $60,000. Is that the only support for that program in this budget, or where is?
And this budget, yes, but they also have donations that goes to them. They're a 501c3.
Okay, so through the budget, we fund $60,000. That's for a salary?
No, salary, equipment, programs.
Yep.
It kind of mirrors. We kind of put it together with the PAL budget to ensure that if they don't have enough, we can cover it somewhere over here. Okay. It's like a stopgap.
Okay. Yeah. Mayor, did you?
Councilman Green. I don't know if the chief understood exactly. It's not just 60,000. The staff position is much higher than that.
Oh, for the personnel cost.
I think it's the whole thing.
Oh, you're asking the total cost?
Yeah.
So I guess it's a combination of that, and then how many? So there are full-time staff in this budget that are dedicated. What portion? How many positions of staff are dedicated to PAL?
Well, there's one full-time, but there's about three officers that are into that too. So there's 3 officers that are paid through the salary line of patrol.
Okay.
If that's your question. I'm sorry, I misunderstood.
Tell them about the cadet program too.
Oh yeah, we do have a police cadet program. You want to sell it? We do have a police cadet program, Explorer program. So that's I think we're up to 17 now. So we do that every Thursday night. We also have a lot of programs in the schools that we run. Inside the school itself, we do like a little mini police academy. We run that every year. We're expanding that actually because it's we've got a lot of interest with that. So those are all picked up in the normal course. Those doesn't come out of the PAL lines. Those are what we're picking up.
Thanks for the clarification. Last question. I'm looking at, I think it's page 56, professional standards. I just see that as a department that has a pretty big uptick. I think the education, was that the one that you'd already addressed?
Correct, yes. 6061 is the line on there.
And then the salary line for having 6 positions maintained is going up 20%. Is that a shift of personnel, or that's a big jump?
It shouldn't have gone up.
Don? Yeah. Don? Don, can you go somewhere to a mic? Thank you.
Looking at previous years, we some of those positions are for school resource, and they get refunded back from Board of Ed at 50%. So if you're looking at actuals, they're usually lower, but we budget for the full amount, and then at the end of the year, the school resource officers, any salary, half of it comes back from the Board of Ed.
Okay, so this police professional standards department contains SROs. How many SROs do we have? 4. Oh, so 4 of the 6 are SROs. Okay.
Correct.
And then we
Right.
get reimbursed back.
And whenever we get back, when they pay us timely, it comes back, we take it back.
Gotcha.
So it's about 80,000.
Yep. Saw the discrepancy. That was a useful clarification. Thank you.
Yeah, go ahead. Caitlin.
Thank you. The dog fund, would we talk about that here, or is that falls under your purview?
It does fall
correct?
under his.
Okay.
Caitlin, what page is that?
That's on page 66.
Thank you.
You're welcome. So under canine fund expenses, if asking for clarification, if it's an error, the dog food line, 2024, it goes from 23 $6,000 to 2024 $70. Is it supposed to be 7,000? What is that line item supposed to be?
Oh, where it says 70,
Yes.
that's 2024?
Yes.
I have no idea.
Dog, our animal control shelter gets dog food donated, so that was a good year for donations that they didn't need to use that line to purchase dog food. But that fund is to purchase dog food for the kennel dogs. It has nothing to do with our canine program.
Okay. Thank you for clarifying. And then canine versus animal control. So the canines that the police department has and utilizes, this section of the budget, is this just within the police department, or is this reflective of animal control?
Animal control.
Thank you. Do you have any updates or anything you'd want to share for animal control, or I didn't hear anything earlier?
I mean, they're well respected. They do a good job. So, and they answer a lot of calls. We do get a lot of animals in.
Thank you. That was going to be my next question.
I actually had my mother adopt
Do you know
one,
their
so we
call
got one
volume?
back. What's that?
Sorry.
I had my mother adopt one, so we took one out.
Oh.
There you go.
Chris took one too.
That is wonderful. The call volume for animal control, I know the counselors, we all get phone calls about various different issues with animal control things. Do you have any data that you'd like to share? I have no idea what their actual call volume is like.
We do it on the monthly public safety meeting. It's in there. I can't remember the latest, but I can share it if you like.
That would be helpful. Thank you.
Anyone else? Chris?
Just realized, since you guys do have a place in the beginning of the book in revenue on page 7, just did want to ask, I know we're bringing in the cameras in the 4 locations. I see the projection here, 500,000. How did we get to that number? And is everything going to be in place? And are we sure about that number, I guess?
Well, it's based on the number of violations. So, that's what we're basing it on.
So it's just a straight
There's 5 locations, 2 cameras each at each location. Plus, we'll be rolling out the next phase of this too. Hopefully before the end of the year.
So this number was taken by multiplying the rate of infractions observed by the 4 sites, basically, and putting it over a year?
Well, the infractions if you had the total paid of all of them, it'd be more than that. But we're just kind of estimating what's going to be. We don't have an exact, but I think it's a decent number.
Yeah, we did a formula one day, and I don't remember what it was like. If each camera does 10 a day, you get to like $500,000 pretty quickly.
Okay, so we're assuming at the 4 locations, 10 infractions a day over a year. That's what this is from. Okay.
But the conversation's been more than 10, so that's a safe number. So
there's 10 cameras, so they're getting north and south, so all these locations.
Because there's more than 1 per site, because you have different angles.
Correct, and we'll be rolling them out to other sites.
Okay.
Okay, if everybody's all set, we're going to wrap this section up, and we're going to recess till Wednesday, April 9th at 5:30, where we'll be talking with listening to the Health Department, Community Services, Senior Center, GBTA, Sterling House, and the library. Thank you, and subject to change, but probably won't. Thank you.